Welcome to Speak the Truth in Love with Clint Day from St. Simon's Island, Georgia on WCGA 1100 AM, where we do speak the truth in love based on Ephesians 4:15. In today's woke PC culture, there are many forces that want to stop free speech, especially for people of faith. Good men and women must be willing to stand up for their faith and be the salt and light to preserve our freedom. True freedom comes from faith in Jesus Christ. In John 8:32, God's word says, "The truth would set you free." Today, I'd like to welcome you, friends. I'd like to welcome a new great friend, Mark Gibbons, Dr. Mark Gibbons.
Thank you, sir.
Mark, it's great to have you here today, and I'm very excited about what we're going to talk about with you today. The primary thing is we're going to be talking about a new concept that you and your friend Leo, our mutual friend, have started that's really exciting for our community and really applies to anybody around the world, literally, the opportunities with stem cells. So tell us what you're doing.
Well, absolutely. Hit the nail on the head. This is an opportunity for anyone. You don't have to have a disease. You don't have to be male, female, adult. This can be done on any individual. We use what's inside you to help heal you. And these are cryopreserved. In other words, they're frozen. So they're frozen for your family members. If you're got children that you might want to leave this line of stem cells. These are stem cells that can reproduce, but the beauty of a stem cell, and probably some people have heard about it in the last 20 years, we've used them for cancer. We are not using ours for cancer specifically. We're using ours for degenerative disease or any type of injury, trauma, and these stem cells are recovered from your body and they're only for you. You can leave them for your children or you can even give them to your parents. But the stem cells in your own body can heal you, just like a physician can prescribe medication or do surgery to heal. Stem cells, this is a painless procedure. It takes all of an hour, hour and a half. The stem cells are sent to a cryopreservation lab in Indiana in the United States, and we have access to them in 48 hours. So if you came in and said, look, I'd like my stem cells this week, we do it on Monday or Tuesday, we can do that. Typically, we will take out the stem cells, we overnight them to Indiana, and then we have them preserved there. They filter them, and they will be kept for 20 years. And the fees for doing all of this are minimal compared to, say, the price of a surgical intervention or long-term medical care. This is a one and done.
That's fantastic. Well, the thing about it, again, I have a degenerative disease, muscular dystrophy, and one of the challenges is they really never have anything they can quote help you with. They've always said, "Look, we're looking for the right medicine." I happen to be missing a chemical called dysferlin, which is a chemical that is in your body that helps rebuild muscle when it breaks down. So I don't have any supposedly. But I was an athlete when I was younger, when I was a kid, so really it was a more adult onset. And so they never really have anything. Keep thinking they're getting breakthroughs. How would it help the stem cells of someone to put them back into themselves? How are you seeing that help people?
Well, first of all, I think it's beautiful the fact that this wasn't a disease that you had from early onset. So we know you had this chemical
Right,
in your body when you were an athlete.
right,
So we know that stem cells, which start out as being able to become heart, liver, lung, other organs, these stem cells will have that genetic code. Now, does that mean it's going to cure? And I don't like to use the word cure, we treat.
hmm
In Georgia, we cure things like hams and bacon, but we treat disease through your own stem cells, which are recovered from your body and are just for you. And these stem cells can become uh, rejuvenative to joints, knees, hips, ankles, backs, necks. We are also seeing in the research being used for things like Parkinson's disease, where the defect is dopamine. And we all know there's great strides in medicine, but right now, this is the cutting edge of medical therapy that is available here in Brunswick, Georgia, through a stem cell corporation. And that is what I am part of and happy to be the medical director for. I was trained as a urologist, as a surgeon. I was trained at Walter Reed Army Medical Center, which is the flagship of Army medicine. We were the center for prostate disease research, and we've done all the research in prostate for all branches of the military, for dependents, family members. But I will tell you this makes that seem minuscule because we can treat the entire body with stem cells. I will say this, research is the key to medicine, and this is a research that's ongoing, but has been used to treat cancer for over 20 years and shown to be safe, and it is FDA approved.
That's fantastic. Well, take us through the process again. You explained a little bit. Again, the name of your company real quick and their phone number.
Okay. The name of the company, and I'm new here, Cell Cure Trust, LLC. And that is the stem cell company. And we are here in Brunswick on Palisades Drive.
You got a phone number?
Yes, sir. I do have a phone number. It is 912-254-7323.
Say it again, please.
Yes. So 912-254-7323. And our email address is info@cellcuretrust, all lowercase.com. So Cell Cure Trust is the name of the company.
Fantastic. That's awesome. Well, that's a really good information. Now, again, bring us through the whole process. We're wanting this procedure done because we feel like it's going to help us. In my case, with my muscle disease, I'm at least try it, right?
Right.
So, and of course, I have other things. I have a wound that's been having trouble healing, and I've had one particular doctor recommended I do the stem cell procedure. So, help us walk through it. Help us understand how they said, okay, I want to do this. I do want to try it. I've heard of people, like you said, with knee joints. They were afraid they were going to have to get a hip replacement, and all of a sudden their hip somehow supernaturally gets better. Obviously, other people have had to go ahead and go through the hip surgery or whatever, but I've heard people definitely get benefits from it. So walk us through, what do you have to go through to get this done?
Well, the first thing you have to say is, I'm willing to look at an alternative therapy to traditional medicine or traditional surgery that may offer you benefits. And you might say, well, are there any other choices out there beside having an invasive procedure such as surgery with a recovery time and certain complications, but again, in the right hands, a very good treatment? What if you could have that same response and the same result without surgery?
That'd be fantastic.
I think most people would say, hey,
totally.
Doc, let's go.
Most people go to the nth degree in terrible pain. I know a lady that's involved with the ministry here in town that's just done everything she can to avoid that hip surgery that she needs. It's a fairly young lady, like 61 years old, and she's done everything. We know plenty of people that have fit that category where they just fight, but you reach a point where you got to have some pain relief. So go ahead.
Correct. And again, traditional medicine, if you have pain, what's the first thing we do as physicians? We offer you pain pills. No, that is not the treatment. All you're doing is masking the symptoms. So we've got to go to the root cause. Your lady friend would be an ideal candidate for stem cell recovery. We actually get the stem cells from her tissue, from her synovial fluid, with nothing more than a hypodermic and a small needle. We will use a freeze spray to numb the skin. We take the fluid out. Once we have the fluid, then it is sent in a FedEx frozen package to Indiana. All she has to do is come in and say, let's go. And it doesn't take any more than taking fluid from the synovial sac, which surrounds the joints in the knees. And we have found that there are more stem cells in this one area of the body. There are stem cells everywhere in the body. Originally, stem cells were taken from amniotic fluid,
That's right.
from the placenta.
That's right.
And the FDA has sort of looked unfavorably at taking those. And due to the current culture, this is an FDA approved method.
Okay, so I send my stem cells to Indiana.
Yeah, we actually do it
Right,
for
or
you.
what you
Yes,
do
sir.
it. You do it. And,
Yes, sir.
And so they're up there. Are they growing in that process?
They are. And the stem cells will
Even though they're frozen.
Once they are thawed, they start to reproduce. So if we got 10 million stem cells, which is about average, with a few mLs or milliliters of fluid, very small amount of fluid, we can keep those going up to 20 years. Now, we haven't gone beyond that because we haven't been in business that long, but we know the stem cells would be useful for you, perhaps your offspring. God forbid they would have any of the symptoms or perhaps an injury, something like that. These stem cells will do three things. They will reproduce, they will regenerate, and also go to damaged tissues, and they will repair. So this is how it is being used today, and this is cutting edge, and it's useful for a multitude of diseases, most of all degenerative or traumatic injuries. And we will see very shortly in the future whether it is used for things like Parkinson's, horrible diseases. But we don't offer a treatment that is not going to help you and has minimal side effects. Anytime you put a needle to draw fluid off, the biggest side effect is going to be bleeding. So, but again, small needle, it would be like going to your doctor. They have to draw blood and they say, now we're going to wrap your arm, keep a little pressure on there for 5 minutes.
Right.
That's what you have to do.
That's fantastic.
Yes, sir.
And again, you've seen a lot of people. Tell me some cures you've seen or heard about or in your studies you've seen.
Well, again, originally stem cells were used for a variety of bone marrow diseases like lymphoma, leukemia, and those stem cells are replaced in the bone marrow. We don't do that. We take your cells from that synovial fluid, we preserve them, we filter them, and they're available to you, and they are placed back into your body through a very simple procedure. We don't put needles into joints or into your back or into your spine and places like that. These actually go in through a blood vessel. So it's an IV, intravenous. And that is, as of 2024, an approved FDA method for replacing the stem cells into your body. The stem cells that you have the potential to heal and also produce the perhaps the missing element for muscular dystrophy.
Yes, yes. Well, I'm increasingly amazed at how God has worked all this out. Because I remember a lot of the debate in the early days of stem cells was you needed the umbilical cord, right? And they were like, well, since we're aborting these babies, why don't we just use baby parts to do this? And the pro-life community that I was very involved with and still am were like, we can't do that. That's unacceptable.
Right.
We can use these things. We can study these things. And they were convinced that those parts would make a difference in this research and helping people. And sure enough, sure to form, the pro-life position won out again. They were 100% right to the very thing you're saying, that you can literally get them from yourself now. They figured it out, so they can put those stem cells back in your body and be a super healer for your body. And yet the other side would say, no, that's not going to work out. We got to use these parts. And I'm still 100% pro-life. I'm amazed in our country how we sometimes accept the pro-choice argument of the woman's, quote, right to choose when they're killing a preborn child. Okay, I didn't mean to get going down that too much, but we do not need to sacrifice preborn children to see cures for adults, right?
Well
And if
said.
we don't protect the most innocent life, no one's protected. And we're seeing that even with older people now, or people with handicaps of whatever they are. The Social Security system and Medicare are starting to say, "Hey, we've done enough. We've done all we can do." And yet, we know in our society, if we don't protect from natural conception to natural death, we got to protect everyone, or no one's protected. Eventually, in the middle, even. I'm so big on that, and so I'm so excited that your worldview would be the same. Coming out of the military, coming out of what you've come through in life. So tell us more about your story, about your testimony, about how you came to be the person you are today, because I know you're a man of great faith. You've been through a lot of pruning. You've been through a lot of situations like any person but yours, sometimes yours is more, especially recently. But go ahead and tell us your story more of your coming to America, even.
Well, I certainly will start there. But before I say that, I would like to say that what you just have recited to me and told me regarding pro life couldn't be more spot on, as we would say in England. I'm British. I was born in England. My father was in the Royal Navy. He enlisted at the age of 15, and he served on the Ark Royal,
Wow.
which was one of the premier aircraft carriers. And he was on board that Ark Royal aircraft carrier during D-Day.
Wow.
He lived to be 86. He had diabetes, and that was the cause of his death. But during his life, he gave me everything I desired, and I was his only son. Came to this country when I was in grade school. I don't know how my father and mother did it, but we never wanted for anything.
Yes.
He was not a wealthy man. He was an enlisted man. He was a chief petty officer, and he was a food and beverage manager after he left the Royal Navy. He went all over the world, Rock Resorts, which is Rockefeller Resorts. He started off in Colonial Williamsburg. Being British, they said, now Art, he went by Arthur, his name was Art. They said, we would love you to write the menus and have them for the Williamsburg Inn and the Williamsburg Lodge, which is, beautiful
It's
food.
amazing.
Yes.
Yes.
And of course, his was all authentic British.
Yes.
So he just fell right into that. And I was in school in Virginia. I knew that I wanted to become a citizen. So I was naturalized while I was in high school and went on to the University of Virginia, where I studied mainly partying,
Yes.
which won't get you into medical school. So that's where the Army came in. I went to my pre-med counselor, and he took one look at my transcript for the first semester. He says, now, Mark, with these grades, you're not going to get into any medical school, except perhaps in the Caribbean or in Mexico. I said, well, that's not my goal. My goal is to go to medical school here in the United States and become a surgeon. And I read a book by a surgeon who was up in New York, and he was in Bellevue, which, of course, New York City, and it was called The Making of a Surgeon by William A. Nolan. And that book had more to do with me wanting to be a surgeon.
Wow.
But I was raised Anglican, confirmed, christened, confirmed in the Anglican Church. And when we came to Virginia, I became a Christian in the Episcopal Church, St. John's Episcopal Church, the oldest English-speaking church in the United States.
Wow.
Hampton, Virginia. So I was part of a community of, great faith. And when I went away to school, I did not apply myself. I didn't know you had to study to get good grades because it came to me too naturally.
I can totally relate to that.
Yes, sir. So my counselor was very astute, and he said, now, Mark, have you thought about perhaps going into a medical field other than a physician? And I said, no, sir. He said, well, if you go in the Army, you could perhaps be a physician assistant. And I said, well, I don't know what that is, but I'm going to take your advice, and I'm going to take a leave of absence from the University of Virginia, and I'm going to go and enlist in the Army. I took the battery of tests. They said, well, you did so well. We would like to make you an interrogator and an interpreter. And they were going to send me for a year to learn a foreign language so that I would be just indoctrinated.
Mhm.
And they said, this is going to, be your future. I said, no, it's not. I said, the only reason I'm here is because I want to do medical therapy. I want to do something in the medical field.
Mm.
And the recruiter said, well, we've got a couple of openings. I said, tell me what you got. The highest level they had was as an operating room technician. I became an OR tech in the Army for 4 years as an enlisted man, traveled all over Europe, had a wonderful, wonderful experience. And I worked with surgeons as handing them the instruments. I would set up the trays, hand the
Sure.
instruments, and I did that for 4 years. When I left the Army, I knew that I was set to, to study because I had the discipline, the self-discipline to get through school, had a 4.0 average.
Wow.
So I went from about a 1.8 to a 4. But of course, when you average all that, I believe I had about a 3.3 average. And most of those applications go in the circular file.
No doubt.
Yeah, the trash can when they see them. Because everyone has a 3.8, 3.9. Some have a 4.0. But anyway, I did get an interview. I had one interview out of all my applications. And that's when I got to sit down in front of them. And they looked at my grades and said, now, why do you want to be a physician? And of course, usually that's the route answer is you just want to go into a physician. You want to be a physician to help people. And they said, well, if you want to help people. So I knew not to answer that. I kind of knew what not to say.
Yes.
But all of a sudden, I'm sitting there in front of the dean and the assistant dean, the pharmacy chief, all of these doctors. And I said, I held up my hands and I said, this is my gift. And I'm a healer. I want to use my hands to heal. I don't want to be the one taking the commands. I want to be the one that is actually doing the work. I said, the work in my hands is not going to come from me, but it's going to come from a higher power, from God. And if you entrust me to go to this medical school, I promise you, I will make straight A's, good grades, and become a surgeon.
That's fantastic. And I think about the GI Bill, for example.
Sir.
My dad failed out of Mercer in Macon, always wanted to go to Georgia Tech, went into the Marines, got his life back together. Well, and really grew up in a big way. Obviously got married too in the Marines and had a couple babies. And so the GI Bill made a big difference. That they had to allow him at Georgia Tech at least to try. But like you, would have never been able to get in there without that GI help, that GI Bill actually. And the rest is history. He, did very, very well with a degree from Georgia Tech. So when you go back to your situation, so you've been in the military, the Army for 4 years, then you go back to school. Is that correct?
Correct. I finished
And then you have to go back in the military.
No, actually, that's a good point. And I will say, Georgia Tech is a heck of an engineering school.
Yes.
But I will say, we're in the same conference. We're all
Absolutely.
Atlantic Coast
That's
Conference.
right.
And we might not have the best football team in the state of
Yes.
Virginia.
Yes.
And we certainly didn't have, football that would go anywhere, but we had the best basketball in the
Yes, you
country.
did.
And of course, we won a national championship.
Yes.
But I will say this, when I went back to school, my purpose was to get grades to get into medical school. I didn't think about how am I going to pay for medical school because my undergraduate school at UVA was covered by the GI Bill.
Wow.
Which was beautiful.
Sure.
And back in the day when I was going to school, you could pretty much go to school on a shoestring budget. It wasn't like it is today. But the beauty of it was that they basically allowed me to go to school, study, apply myself, get the grades, take the MCATs, the medical college admission test, get into a school. And then I looked at the tuition and I said, well, I'm going to apply for a scholarship. And I thought, what better scholarship than the Health Professions Scholarship, HPSB? And the scholarship could have been any branch of the service. At the time, of course, my father was alive and he's Navy. My mother had remarried and married a Naval Academy grad
Wow.
who was also pushing me towards the Navy. But I knew the Army, and I started from an E1 private, which is the lowest you can start at,
Hmm.
and made it to E5, which is equivalent to a sergeant. And I did that in pretty much record time because
Hmm.
I knew what I wanted to do and I
Hmm.
was good at it. The doctors that I worked with as a technician to hand them the instruments and set up the tables and do all of the what I would call the work. They were the surgeons. One of them said to me, "Now, Mark, if you ever do come back into the military and you want to do medicine, seek me out."
Wow.
And that's where I ended up. I ended up in the Army. I did a weekend for, just basically once or twice a month. You do a weekend. And then in the summer, I did about a month's long training, but I didn't have to wear the uniform except when I was on training. And I went to Fitzsimmons Army Medical Center after medical school, which is in Aurora, Colorado, a small suburb of Denver. And the chief of neurosurgery was one of the same surgeons I had worked with when I was over in Landstuhl, Germany, which is the major medical center. That's the first stop for troops that are wounded coming back from
Yes.
theater,
Yes.
Afghanistan,
Hmm.
Iraq. They go through Landstuhl, West Germany. Of course, then it was West Germany, now it's just Germany. But Landstuhl was the medical center. So uh, I had the good luck and the good fortune to really apply myself. And when I applied to be an intern at Fitzsimmons, my very first rotation, because you do about 12 rotations during a year, you do one a month, was in neurosurgery, working for the same colonel that had been on the other side of the table. And
Wow.
yeah, it's
Well,
funny.
and that really is the hand of God. I mean, he's
Absolutely.
preparing you. He's opening these doors.
Right.
He's helping you understand the disciplines and everything going on. When I think about people though that have certain goals, they have a God-given desire in a lot of ways. Yours was a God-given desire toward being a surgeon, of course. So when you feel somebody is having that kind of tug, if you will, my brother used to call it like a tug from God on your heart to get you to do a certain thing. And he would describe it as, a lot of times you'll be flying a kite and it may get up in the clouds. You can't even see it, but you can feel that tug on that string. So it's up there somewhere and it's flying. And so how would you encourage someone to follow that tug, to
Just
do what God?
trust your heart, trust God that you're in the position you want to be. I never thought of, when I was in the Army, I never thought of any sacrifice. I didn't get paid what a civilian physician got paid. I love my work. I love my job. I went to work every day. The colonel that was in charge of neurosurgery would go into his office at 3 in the morning. Even the interns and medical students weren't awake. And he's the chief. And I said, "You work way too hard." I said, "I would love to do a surgical residency, but I would like to do one that allows me to sleep in the morning until about 5 or 6 in the morning." And he just laughed and he said, "Well, maybe neurosurgery is not your calling." And neurosurgery, wonderful, wonderful
Hmm.
specialty. 7 to 8 years, depending on the program. 7 year program plus 1 year of research. But
Wow.
8 years seemed a long time for me to be a resident. When I'm ready to start practicing. So after my 1 year internship there at Fitzsimmons in Colorado, by the way, it was called uh, Eisenhower's Hospital because it was a TB hospital originally
Mm,
for troops that had TB
wow.
because of the low oxygen content at Mile High.
Hmm.
But that I digress. I was sent from Fitzsimmons. I was sent overseas, not to the same hospital in Landstuhl, but one in Würzburg, which was about 2 hours down the road. And it was a CASH, which is a combat support hospital. I was there during Kosovo. And of course, we sent support there. And I worked in a clinic as what's known as a general medical officer. So 1 year of training, took a variety of subjects during that 1 year. And after that, I was a practicing physician in the Army, and I was called a field surgeon, but I didn't get to do surgery, so I knew there was something still waiting for me. I was in Germany, loved Europe. Being British, I was close to home. I could drive from Germany to England without going across there's no bridge.
Channel.
I did the channel, exactly. You go through that channel. When you come out on the other side, just remember you're driving on the opposite side of the
Yes.
road. But it was a beautiful experience, loved it. And I thought, well, I'm willing to stay in Europe and be a general medical officer because I'm loving what I'm doing. I'm basically doing everything that a physician in this country would do as a family practitioner with only 1 year of training.
Amazing.
So it was a lot of learning on the job.
Sure.
So I had the chance to go to a small clinic in Livorno, Italy, on the beach.
That'd have been nice.
Camp Darby, Italy. Yes, not only nice, a little better weather than Germany, beautiful, the Italian people. I traveled to Italy and just loved the lifestyle. This is back when there was no euro. It was lira, I believe, when you went to Italy.
Right.
And I would change my German Deutschmark, which I didn't have a lot of, but as soon as I crossed the border, I had 1 million lira in
Absolutely.
my pocket. So I was
Yes.
I would live quite well.
And it would inflate really quickly down too. Seemingly, they had a lot of inflation in a lot of those periods in Italy, particularly. But I love that story. And again, when you think about where you are in that process, are you married at this time?
Yes.
Do
Yes.
you have children, or do you?
No children.
No
Right.
children.
I got married. I was in San Antonio
Okay.
the second summer of my training, and I still had 2 more years of medical school. And it was one of those love at first sight. She was a Texas girl. She worked for a bond brokerage, and she said she had just been given her dream job in Houston, Texas.
Oh my goodness.
And when I told her what I did, and I said, well, I'm going back to Miami. If you ever get to Miami, please look me up. Well, I got back to the base, and we were just finishing up the summer, and there was a message on the board there, Captain Gibbons, because I went from being an E5 to an O3. So it's quite a promotion in
Yes.
medical school. We have a message for you. Someone is trying to get in touch with you. And the first thing you think of when you hear that is, God forbid, something
Absolutely.
bad has happened in
right.
the family. My mother and father are still
Right.
living, and my sister. But I took the message, and it was, would you like to have lunch at Bill Miller's barbecue, which is kind of like, I don't know what we have here.
Southern Soul.
Southern Soul. But then Bill Miller's is a chain, and they were good.
Mm-hmm.
But so fate would have it that I was driving back to Miami. And so I went to Bill Miller's barbecue on my way back to Miami and ended up meeting the love that I'm still in love with. We're separated, but we still love each other.
Mhm.
No children.
Mm-hmm.
She went to Germany with me, and she loved Italy also.
Mm-hmm.
I put in for what they call an inter-theater transfer because I wanted to stay in Europe. And they gave me the job at Livorno at Camp Darby to be the clinic physician. And I was all set to go, furniture being packed, the movers getting ready to move me down to Italy. And I received a phone call. And I'll never forget, on the other end of the phone line was a Colonel David McLeod. This gentleman was a gem. He was a prior Marine enlisted. So we had that in common. We're both
Yes.
enlisted. He became the chief of the residency program at Walter Reed Army Medical Center. And he said, now, Captain Gibbons, I understand that you're interested in being a urologist. And I said, yes, sir, but I'm putting that on hold right now because I'm going to Italy to continue being a GMO, General Medical Officer. And he said, well, I'm going to give you an ultimatum right here, Captain, over the phone. I said, well, sir, with all due respect, Colonel, my wife has already told me we're going to Italy. And he said, well, if you do, you will not come to Walter Reed.
Oh my
He
goodness.
said, if you take another couple of years to be doing general medical officer type uh, practice. He said, we won't even consider you. He said, and your program at Fitzsimmons, by the way, has closed. So he was going to close 2 doors in one phone call.
Wow.
And I said, well, sir, I already have orders. I am getting ready to go to Italy to Camp Darby. And he said, well, don't worry about that. I'll take care of that. And I said, what do I need to do to come to Walter Reed? And he said, you just have to give me your word that you will come to this program and make it through the program and become a urologist. And he said, if you decide to go to Camp Darby, you'll probably end up becoming a civilian, and you might not get into a residency or a specialty of your liking. And I just thought about it. I didn't have to even talk to my wife. I said, sir.
Yes, sir.
Yes, sir. I said, I will be on the next plane to Washington, D.C., to Walter Reed to become a urologist. I didn't know how to break it to my wife at the time, but I knew she would understand.
Sure.
Colonel McLeod took me from being basically a primary care doctor, which I was doing fairly well. I wouldn't have done great in, but I liked it, to becoming a urologist in that one phone call. And I said, well, I have orders to go to Livorno. Colonel David McLeod never became a general for one reason, because once you become a general in the medical corps, which is all the physicians, you are an administrator. He wanted to take care of patients. His claim to fame was treating the men, and most of them were men that were local there or anywhere that had testicular cancer. He was on the cutting edge of testicular cancer. Now, when I came, testicular cancer, that was one of the true stories of success, treating testicular cancer, combination of surgery and chemotherapy. It was one of the very first chemotherapies that was effective. Lance Armstrong, the famous bicyclist, had a testicular tumor the size of a softball. It had already metastasized. Remove the tumor, take out the lymph nodes, and then give the chemo. He was, quote unquote, cured. And of course, went on to fame.
Absolutely. That's amazing. Well, when I think about that, though, was that caused by chemicals from, bombs or Agent Orange, or was there a high number for whatever reason?
Well, I believe at the time there was a high number of testicular cancers that were not being aggressively treated.
Okay.
The beauty of Walter Reed is you have a hospital, a medical center that brings in all the finest specialists.
Right.
And right next to Walter Reed was Walter Reed Army Institute of Research.
Amazing.
And the pathologist who was doing genitourinary pathology was the #1 pathologist in the world for GU tumors.
That's amazing. That is
so
incredible.
We had all of the expertise at Walter Reed. Colonel McLeod, who had more power than all the generals put together. The next day, I went to the hospital commander and I said, my orders have been changed to, instead of going to Camp Darby, I'm going to Walter Reed. He says, how can that happen just overnight? I said, I don't know, but I trusted what I was told.
Were you giving God the credit for that at that time?
How else?
Okay.
I mean, I'm not even thinking I've got a chance to become a urologist when I get this call out of the blue and he says,
well, you were faithful in another job, and then God opened that new door open for you. And all that job you were doing was preparation for where you were going. And a lot of times people feel like they're stuck in a place they don't want to be, but they got to realize a lot of times that's part of the preparation to get you where God really wants you to be, right?
And the amazing thing was, the hospital commander called me back later in the day. He says, I don't know what he did or how he did it. Because Walter Reed is close to the Pentagon. I had new orders to go to Walter Reed to become a urologist within 24 hours. That never happens. I mean, how could it possibly benefit me? And so I left, family. I left the wife on the next plane. And my first day in the urology department I was in charge of all of the outpatient treatments. So there were urologists from all the services would send difficult cases to Walter Reed. If they were outpatient, they came to see me. And I'm thinking, wait a second, I'm seeing all of these, difficult cases that board certified urologists are sending to Walter Reed, and I haven't even done a residency yet. But he made me the clinic urologist for 2 years. That was part of my
Threw you in the fire.
yes,
Said,
sir.
get it going. You're
And
gonna learn how to do this.
I got on the job training, which
Absolutely.
consisted of
That's
about
it.
3 days of how to put instruments together to do procedures in the clinic, how to perform clinic procedures. But it was amazing. They're like, well, what can we tell you? And I said, well, all I can tell you is I want to be a urologist, but all these patients coming to me have already had $1 million workup.
Mhm.
And now what am I going to do? And they said, well, you'll figure it out, Mark, because you've got all this staff here.
Mhm.
And I didn't have to go to the bottom rung. I was basically thrown into being the chief of the clinic at Walter Reed.
Wow.
And the surgeons that were there took care of the inpatient.
Colonel McLeod knew something about you.
Well,
He knew you
and,
had
and
a
I
certain
think
gift.
he
He
trusted the
saw your
fact
leadership abilities.
that I would apply myself during those 2 years as the
Mhm.
clinic man to be able to hit the ground running.
That's good. Well, I always love asking this question,
Yes, sir.
kind of going a different direction. And if you don't mind just sharing, what is one of the biggest setbacks that has ever happened in your life that you're willing to share that's helped you become the man of God you are today?
Gosh, setbacks. Well, I will say I married my high school sweetheart when I was in Virginia. She was super smart, finished high school in 2 years, went to the University of Virginia, wanted to do sociology. When I got out as an enlisted man, and now I'm starting back to UVA, she was finishing college. And I said, well, now's a good time because I know we're going to be stable. We'd known each other for 7 years
Mhm.
before I married her. We got married in the spring, and that summer, she decided to go to the University of Richmond to become an attorney, to go to law school.
Mm.
So here I am,
So a doctor and a lawyer.
well, and everybody's like, well, but of course, I'm
Two
still
very smart, strong-willed people.
right. But she was super smart, applied herself, got into
Yes.
the University of Richmond,
Wow.
and instead of saying, well, we're going to just stay apart, and I would finish school and then move to Richmond, or she would finish law school and come to Charlottesville. We didn't do that. And I should have, that was my biggest disappointment, that the marriage failed.
Mm.
Very, very difficult time. She was applying herself
Sure.
in law school. I'm trying to get the best grades I can to make up for my slow start,
Right. I
just like
understand.
your dad
Right. So
had.
now we only have about 6 or 7 minutes, believe it or not.
Yes, sir.
So recently you've been through some very difficult things. You came to Dublin, Georgia, working with a VA. Is
Yes,
that
sir.
correct? And tell us kind of real quickly how that happened and then what's been going on since that time.
Right. I decided after I got out of the Army to go into private practice. I did private practice. I was fine with it, but all they wanted was the money. And so I looked at the VA, applied to the VA, and they said, yes, we have a urologist opening in Dublin, but you'll have to move.
Dublin, Georgia.
Dublin, Georgia,
Mhm.
yes. And I'm living on St. Simon's. And I said, no, I really don't want to go to Dublin. I said, I've done my urology bit. Is there anything you can do for me in Brunswick? They said, yes, you can go back to being a GMO, basically a GP.
Sure.
And I said, yes, I'll do it. Well, that was 2020, and that was when COVID hit.
Mhm.
They shut down the clinic. They said, well, we don't need you as a general practitioner, but we have an opening in Dublin, Georgia for somebody with surgical background, not to be a surgeon, but to be a COVID doctor.
Mm.
And so this is at a time when we had no treatments, we had no vaccines for COVID, and the people who were going up there to work would go for 2 or 3 days and then come home because nobody wanted to be exposed to
Absolutely.
COVID.
Yeah.
These are veterans that are really sick and, awaiting death. And they said, well, we'll send you there and you'll be working there week on, week off. So I could come back to St. Simon's, spend a week, go up there to Dublin, have a week working as a COVID doctor. So I worked 12-hour shifts in COVID, which was a hospice unit that was perfectly set up for treating our veterans.
Yes.
We lost one patient
Wow.
because we did
What a
not
miracle.
put them on vents. We stayed away
Amen.
we
Amen.
treated them the best. And my whole team was OR nurses, OR techs. When I went into a patient room, it had the negative pressure room. So basically there was a holding room between where you could change clothes, go in to see the patient. No one else would go in to see a patient in the hospice unit except us that worked
That's
there.
amazing. So you met an incredible woman there.
I did.
Just we only have a few minutes, so just
Yes.
give us kind of what happened.
She was a nurse that had worked in the hospital there in Dublin. And I met her. Her husband had been at the VA. Her late husband was a helicopter pilot, a true hero, and disabled. She took care of him. When I met her, I was living in a bed and breakfast, and life was good, going back and forth. And I said, well, I'm going to be up here probably for, a few months. And it worked out and we fell in love. But I will say this, she passed away recently from breast cancer, but taking care of her during that time, she was given 6 months. She fought it hard. 18 months she survived chemo, immunotherapy, and CyberKnife for tumors, but it was already stage 4 aggressive breast cancer, and she passed away in November. And I have been lost without her. But it's funny how COVID is what brought us together.
Yes, sir.
Yeah.
So a very difficult time brought you together, and you'll have some incredible years together. And obviously, you really took care of her really well, buddy. We're in a men's group together, and I would hear a lot of the periodic stories from you of just how you were faithful. You never gave up on her. You continued to love her through everything. And maybe what would be a little bit of advice maybe you'd give to someone that's a caregiver that's trying to help someone get through some difficult times, like a stage 4 cancer situation?
Well, I will say this. She did all the hard work. I took her to every chemo every 3 weeks. She would go for her chemotherapy. She took 6 courses of chemotherapy and lost her hair, lost a lot of weight, lost a lot of her strength. Immunotherapy was beautiful. It too was every 3 weeks, but it didn't take the toll on her body like chemo does. And the beauty of immunotherapy, it's targeted to her specific breast cancer.
Okay.
And so her oncologists there were wonderful. Unfortunately, it had started in the torso, spread to her brain.
Right.
Once it's in the brain, the chemo doesn't work, the immuno doesn't work because there's something called blood-brain barrier. So she had to go to the J.C. Lewis Center up in Savannah. And he was a fellow radiation oncologist that had worked with me when I was the urologist. I was chief of urology at Wynn Army Community Hospital in Savannah, and he was still there. And when I saw him, again, it's been 10, 15 years since I was in the Army, and I see his face and I said, can you help us? So I knew that there, and I will say, she passed in November after being in hospice for less than 2 weeks. So she fought the good fight.
Right.
We were riding our bikes on the beach at the beginning of November.
Wow. Well, and the good news is she knew Jesus Christ, our Lord and Savior. So she was promoted to glory.
She was.
She's more alive now than she ever has been. And she's running those streets of gold, and she has no pain. And I know that that's our comfort. That's our peace that we can have, that we know that when we pass away ourselves, when we promote to glory, when God says it's our time, we're going to be with our friends and family that have gone before us. We have that blessed hope. We're so grateful that our names are written in the Lamb's Book of Life. Now, I'm going to totally shift on you. I'm sorry to have to go back so quickly. Tell us a little bit more about the company you're doing, the stem cell company, so we can conclude with that program, that part of the program too.
Right. Well, again, the stem cell company, local here, we do everything in the office here in Brunswick. And when you come back to have your stem cells implanted, we do it here in Brunswick. We do it in the clinic. It's
Okay.
just a
What's the phone number there again?
the phone number there again, and I apologize because I'm new to this company, 912-254-7323.
Say it again.
912-254-7323 and
the
ask
name of
for
the
me.
And then the name of the company is?
The name of the company is Cell Cure Trust.
So Dr. Mark Gibbons, Gibbons, Dr. Mark Gibbons. So we only have about a minute here, so we'll
Yes.
go ahead and conclude, sir. Thank you so much for sharing this incredible story with us, and we're so excited about this new opportunity for the Golden Isles, Mark and Leo. We're just so encouraged by what God's going to do with y'all's company to really make a difference, and I'm looking forward to personally trying to be involved with it. So I'd like to also remind everybody out there, please get the app for 1100 AM WCGA, so you can listen to us anywhere you are in the country. Also get the TNS app, the Newscaster Studio app. Listen to this program and others. Remember, we're on YouTube. I'd like to encourage you to get out there and subscribe to YouTube, where we are, and other platforms out there, other social platforms. I'd like to say good day, friends. Again, thank you, Mark. Good day, friends. I want to thank you for joining us today for Speak the Truth in Love with Clint Day on WCGA 1100 AM from St. Simons Island, Georgia. Remember, every day is a God day.